Okie dokie. Digestion video number 4. So there's really two parts of the large intestine. What we call the colon, the large intestine, and then the rectum area where we actually defecate from. It is not just a place for friendly bacteria to live and help our health in theory, and some friendly bacteria can actually make vitamins. It's also an important place to get stuff back. So if we think about the small intestine, right, very efficient at digesting stuff because pancreatic juice has so many enzymes. We didn't even talk about enzymes that are on the villi. There's enzymes there as well, which we'll talk about when we get to each respective chapter where those enzymes are important for, like, let's say, carbohydrates. Pancreatic juice does a great job breaking stuff down, getting it all the way down into nutrients, and then we do a wonderful job absorbing it, right? But not everything gets in, right? Not all the fluid you consume, fluid that you commit, saliva, gastric juice, pancreatic juice, gets absorbed in the small intestine. Not all the minerals that you consume get absorbed in the small intestine. Dietary fiber doesn't even get broken down. I mean, it just shows up almost completely intact in the large intestine. So what shows up would be things like water, minerals, and fiber. And what's going to happen in the large intestine is an active system by which we pull as much water as we can back into our body so we don't die from dehydration, extract as many specific minerals as we can, and then the fiber, we don't absorb that, we don't break it down, but the fiber does have a couple benefits. First off, gut bacteria can use it for fuel, and that actually might make compounds which are healthy for our GI tract and may affect our overall body's health. Secondly, like I told you, the small intestine, the esophagus, and the large intestine, they're not very muscular tubes. They have these striated rings of unstriated smooth muscle, which just kind of, can unaggressively push food along, peristalsis, and they need help. And what fiber does is it pushes back. It gives the colon something to push on. What's easier to get through a garden hose? Peanut butter, squeezing peanut butter through a garden hose, or, and this is again kind of gross, putting peanut butter in the garden hose and then following them up with a marble. Squeeze the marble, get the peanut butter through the garden hose. That's what fiber does. It gives your colon something to push on. Another benefit of friendly bacteria is they can make some vitamins. Vitamin K, which is a clotting vitamin, and biotin, which is used like everywhere. Those are made in the large intestine, in the colon. So we take back our water. We take back minerals as much as we can. We may absorb vitamins that were made there, not eaten, made there. And then dietary fiber gives the muscles, the kind of weaker muscles of the large intestine, something to push on. What leaves the body mostly? Dead bacteria and fluid. Okay, now, what are some common problems? Number one is constipation. If you are having issues going to the bathroom, you haven't lubricated your colon very well, it's dehydration, or B, you didn't give your colon something to push on. We know that for people who have constipation, we always recommend more fluid in their diet and more dietary fiber. Give your colon something to push on. Diarrhea. So lots of things can cause diarrhea, and when it's frequent, that's dangerous. Typically, the concern for diarrhea is if it's 1 or 2 days, we don't want a patient or a child or an elderly person losing a lot of fluid. The problem with diarrhea is dehydration. Hey, you can die from that. Vomiting the same way. If it's vomiting every now and then, if it's infrequent, it's because you're sick. It happens. Frequent vomiting, frequent diarrhea becomes a dehydration risk. I talked about heartburn, right? We know GERD can hurt your esophagus if you don't treat it. Yes, you can use medications to neutralize the acid, but if the underlying behavior is there or the causes, then that's a discussion you have with your doctor, how long you want to take medication and Tums for. Peptic ulcers, so ulcers can form. Ulcers are basically irritations in the stomach wall. The number one cause of ulcer, by the way, is a bacteria called H. pylori. And you might be wondering, well, how can bacteria survive the stomach, Professor, if acid kills everything? Because H. pylori get below the mucus layer. They're pretty smart. By the way, most folks carry H. pylori. And for whatever reason it causes an infection, and it becomes aggressive and it starts to cause pain and issues, then they would treat it with antibiotic, and there's a way to test for it. Other than H. pylori, another big cause of ulcers are the use of NSAIDs, non-steroidal anti-inflammatory drugs. The longer you stay on Motrin or ibuprofen, the greater ability you can to make your mucus layer weaker and actually decrease your defense mechanism against your own stomach acid. So we know that you're not supposed to take NSAIDs all the time, every day, forever. Don't ask me. I'm not an MD. Ask your doctor. They should be used, typically for whatever injury you're dealing with, and then you get off them, right? But the number one cause of ulcers is actually a bacterium that the vast majority of us carry. Irritable bowel syndrome. This is another very common medical condition we find in the older Americans, middle-aged and older. And what it really is an inflamed colon, an inflamed large intestine. Lots of things can cause this kind of inflammation. For many people, it is a set of foods or food items called triggers. That can be spicy food. That can be caffeinated food. That could be, for many Americans, gluten, wheat protein. It could be soy proteins. It can be stress. It can be unknown. To treat IBS, irritable bowel syndrome, one of the biggest things is stress management. Whatever's causing you to be stressed, learn to deal with it, to cope with it, to work with a therapist, exercise, whatever method you have. And then if you work with a gastroenterologist, a doctor, it would be to find your trigger foods. Is it dairy? Is it fruit? Is it seeds? So the goal is not to have to take medication to calm the GI tract, but to do it via other non-invasive or non-interventive methods other than drugs, like stress management and eliminating which foods are the triggers. Having IBS can be it's painful. It can be inconvenient. We have to go to the bathroom all the time because you feel like you have to go, and you may not really have to go. And the last thing is hemorrhoids and diverticulosis. So what hemorrhoids are basically vascular tissue that come to the surface because you are straining all the time. You are either dehydrated or you're not eating enough fiber, and you are not giving your colon a chance to defecate. And just like bodybuilders, when they flex, all the veins come up. That's what hemorrhoids are. They can be very painful. They can get infected. And long-term treatment is you're trying to reduce the cause of it, right? Constipation. Diverticulosis is a little different. That is, and I don't have an image of it. So that is pockets that form inside the colon that can become infected. It's almost as if your colon is squeezing a water balloon and the little bulges are occurring on the inside. We find diverticulitis or diverticulosis or diverticula, the little pouches, usually in older folks. For those folks, the biggest concern is seeds. If they get in there, that's not good. And they can cause all sorts of pain and irritation. And the last thing, I don't have a little bullet here, is colon cancer, right? Colon cancer is typically a bunch of cells in the colon that just start to grow uncontrollably. And look, where are they going to grow? They grow inward. They grow into the colonic cavity, if you will. How would you know you have colon cancer? Well, there's different methods or different techniques. But number one, you either do the colon guard, that poop in a box thing, or what my physician recommends is you get a colonoscopy. Yes, you drink radiator fluid for 24 hours. Yes, it's radiator fluid. You clean out your GI tract. It's extremely inconvenient. You do not leave your premises. And then you show up in the morning, and they don't really knock you out. They kind of give you like a stupor drug. And they visualize your GI tract looking for polyps. And if they're there, they'll snip them off typically, and then they'll go send them off to a path lab, make sure they're not cancerous. And ideally, when you have this done when you're 45 or 50, there'll be something there, but there won't be a lot there. And the things that we think are good to prevent colon cancer are fiber may help push stuff through all the time, so nothing lingers in your GI tract. And lastly, limit your exposure to cancer-causing foods, fats, fried fats, deep fried fat foods, and foods that are grilled with high heat. Those tend to cause a lot of carcinogens. Okay, this is really long. I totally apologize, but we finished. There you go. Take care.